Okay, see someone else joining. Okay, well, we'll go ahead and get started, everyone. Welcome to our second training in our provider series on various health literacy tips that you can use with your patients or with your clients. So I'm going to move pretty quickly. We only have 14 minutes here. We wanted to make this quick and easy for you. My name is Megan Rooney. I'm with Health Literacy Media. Also with me is Jeremy. Oh, it says Ariane, but that's Jeremy up there. He's with HLM as well. We are working with the Kansas City Health Department to deliver various health literacy trainings and health literacy materials regarding COVID and different health topics to the region. So like I said, we're going to get moving pretty quickly because we want to get straight to the content. Before we begin, feel free to turn on your camera, use the chat, unmute yourself. We are mostly just kind of talking today, but we do have one activity, and also feel free to ask questions or make comments as we go. We'll also send out a summary of this training after the training. And we also have a post-training survey that we'll put in the chat, and we'll also send that out, but we ask that you fill that out. It should just take a couple minutes at most. Okay, let's get started. So most of you, I'm sorry, we don't have time for introductions. Usually I really like to hear who we have, but I'm gonna just keep moving. If you'd like, feel free to put your name and your role and your organization in the chat, and we can kind of peruse that as we get started. Most of you probably know what health literacy is, but we always like to start with a definition so we're all on the same page. So as a part of their Healthy People 2030 initiative, the U.S. Department of Health and Human Services released a new definition of health literacy that distinguishes personal health literacy from organizational health literacy. Personal is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and make decisions. It's an important distinction. In the past, the onus was on the person. It's a personal attribute. And over the years, through research and experience, we know that actually organizations contribute to health literacy barriers, as well as improving health literacy and helping people navigate their system and their health. So we're going to jump right into Teach Back because that is our topic today. So some of you may have heard of Teach Back. This is a proven way, it's been studied for many years now, a proven way to check that you have explained things well enough so that your patient or your client or your coworker, whoever it is you're speaking with, understands what you're saying. This is not a test of your patient's knowledge. This is making sure that you have explained things clearly so that people have the information they need to move forward. So here's just a quick visual of Teach Back. So the first step is explaining a new concept. And then you ask the person to explain it back to you. And we will go step by step through these items. If they explain it correctly, you can move on to the next topic. If they don't explain it correctly, you try again, you explain it in a different way. So that's our picture of Teach Back. Let's show you an example of what this might sound like in real life. So a provider might say, thank you for coming in for your COVID test today. Because of your positive test, here are a few things we recommend you do to keep from spreading COVID. Stay at home, isolate for 5 days. If you live with anyone, try to stay 6 feet away, different room. If you need to be around people, wear a mask. If after 5 days you don't have symptoms, end your isolation, but still wear that mask for another 10 days. That's a lot of information. So the patient might say, okay, yeah, I get it. Okay, thanks. So the conversation could end there. We don't know if they really understand, if they absorbed it, if they interpreted that correctly. So a teach back would start with, so that was a lot of information. I want to make sure I clearly explained what you need to do next. So please tell me, how long do you need to isolate? Did I tell you about isolation? 5 days, and then I should be symptom free, so I can leave the house and then wear a mask for 10 days. So then you would say, well, that was close, but I probably wasn't as clear as I should have been. Let me explain that in a different way when it's safe to go back to your normal routine. Then you might try a different tack. You might draw it, you might write it out, you might use a handout, or you could just explain it in a different way, such as a story or giving an example. So why use teach back really quickly? Because it's evidence-based. So we just have a couple examples here from the research. So a 2016 study showed that before using teach back, patients had a readmission rate of around 13% after a cardiac catheterization, but this dropped to 6% after using teach back. So cut it by 50%. In another study, the proportion of patients with COPD and asthma using their metered dose inhaler correctly jumped from 14% before teach back to 86% after teach back. This is often very useful when describing steps in a process, so how to do something. It can also be used for general information, but that is where a lot of the research lies, is when people are taught how to do something, how to follow instructions. So now we're going to, I see we've got some more people joining us. If you're just joining us, it's a good time to join. We're just jumping into the details of how to do teach back. So the step one, explain the new concept. So when you're explaining something, you're going to explain one concept at a time, being really cognizant of not going off on tangents, not providing too much information, but trying to stick to one concept. Start with the most important information someone needs to know. And this is because if you don't have enough time or something interrupts you, you've hit that important piece. You also want to prioritize the information. So the 2 to 3 number is a good number to keep in mind. So 2 to 3 concepts. So you might want to stick with 2 to 3 concepts as a whole. Here's the 2 to 3 things I want you to remember. And then as you're explaining each of those, you can explain 2 to 3 details. That's about as much as people tend to remember. So an example might be for someone who's newly diagnosed with diabetes, the important points might be how to take their medicine, why that's important, how often to visit the doctor, and then certain foods they should avoid because of increasing blood sugar. So what are your key points? So step 2, you've explained your topic, you've explained your concept. Here's what I want this person to know. And then you start with a normalizing phrase. And this is so that you create a shame-free environment, showing that the onus is on you to explain it correctly, not on them to understand it correctly. So you make sure that patient knows that the goal is to check how well you explained it, not to test their knowledge. So an example might be, we've covered a lot of information. I want to make sure I clearly explained this today, or I want to make sure that I explain these steps in a clear way to you. This can be really complicated. So kind of setting the tone that there's a lot of information, it's complex. Let's make sure I did a good job and that you can take your next steps. So after step 2 is you're going to ask for the teach back. So step 3, when you're asking, you want to use open-ended questions. And so some of you might know open versus closed. Open-ended questions are statements that cannot be answered with a yes or a no. So for example, in your own words, how will you store your medicine? Or in your own words, when will you give yourself that shot? So then moving to the next slide, we've got 5 minutes left. When we ask people, do you have any questions? Most commonly, people will just say no. You know, how many times do you go to the pharmacy? They give you your medicine. They say, okay, any questions? You know, it's easier just to say no. So, but if we ask an open-ended question that you cannot answer yes or no to, we're more likely to have a discussion or to invite people to have a conversation. So we have a quick activity on the next slide. Rephrase each of these close-ended questions to an open-ended question. So you feel free to type this in the chat or just think to yourself or say it out loud. So the first one is, do you have any questions? What's an alternative to that question? So do you have any questions? Close-ended, people might say no. They might say yes.
Would you say, what questions do you have? Would that be more open?
That's great. Yes, Connie.
Okay.
And so Jeremy, you can show us what questions do you have for me? So perfect, Connie. So oftentimes starting a question with what is a good idea, or where, how. Do you know how to take your medicine? Yes. Yes, I do. That's a yes or no question. What's another way we might ask that?
Explain to me how you're going to take your medicine.
Yeah, perfect. So explain that to me. Can you tell me how you do it? Pretend you're at home. How are you going to do that? Great. Jeremy, what do we have? How will you take your medicine? Yeah, both of those are open-ended questions. Do you understand? Do you understand? Is that clear? That's a yes or no question.
How about let's recap what we talked about?
So can you repeat that? I didn't quite hear you.
Let's recap what we talked about.
Let's recap. Let's recap what we talked about. And then maybe follow up with, tell me what you heard. What's your understanding of that? Let's review. Yeah, great. All those types of things that invite conversation. What would you like me to review again? So starting with that what, and then that invites them to give you, to think through it. And maybe they say nothing, or maybe they want you to explain something. So we're going to keep moving. We've got 2 minutes left. If someone doesn't understand the concept, then you're going to explain it in a different way. You're going to use different words, maybe use a visual, tailor it according to what you're assessing are their needs. Do they need a picture? Do they have literacy issues? Are there language barriers? Would a story help them? Keep the experience shame-free, constantly putting that, not blame, but putting the onus back on you. It's my job to clarify this for you.
Mm-hmm.
And so an example there is, I don't think I explained that very well. Let me try that again. Or this is complicated. So let's recap, as someone just said. And then Jeremy, moving on. Here's the teach back picture again. Explain a concept, ask to explain it back, and then it's your job to explain it again if needed. And then kind of keep repeating this pattern until you feel like they understand it. So we hope that's helpful for you today. That was a really quick training. I hope this helped you kind of fit this into your busy day. Here are some resources for learning more about Teach Back. At the bottom, there's even an online training for learning and practicing Teach Back. But like I said, we will send out a summary of this information, and it will include this list of resources for you. So our next training is going to be how to help motivate and support your patients. And we hope that you can join us for that. We are going to put the link to this survey for today's very quick training in the chat. And feel free to click on that and fill this out quickly now or sometime today to get that off your plate. But thanks so much for joining us, everybody, and we hope to see you next month.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye-bye.